Hello everyone, today we are going to talk about double jaw surgery. Do you suffer from problems or deformities in the jaws? Often, oral surgeons perform surgery on one jaw at a time. Double jaw surgery is when they perform surgery on both jaws simultaneously. Double jaw surgery is used to fix jaw deformities. After watching this video, you'll be able to understand everything related to double jaw surgery, such as how this procedure is performed, its benefits, and the expected result for this type of jaw surgery. Our role today is to answer most of your questions regarding double jaw surgery. Today we have Dr. Shin, who is a leading doctor at EU Oral Maxillofacial Surgery. He is going to discuss with us everything about double jaw surgery from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Shin. How are you?
네, 안녕하세요.
안녕하세요.
네.
Okay, we'll start with double jaw surgery. Before asking you a question, can you introduce yourself to us?
Hi, I am Dr. Shin of EU Oral Maxillofacial Surgery.
안녕하세요.
So go straight to the question. What is the difference between double jaw surgery and facial contouring surgery?
The biggest difference is that the double jaw surgery consists of relocating the teeth, while facial contouring surgery does not involve moving the teeth. Thus, if there's an asymmetry to the face that involves a teeth or malocclusion, which is mismatch between the upper and lower jaw, double jaw surgery is effective. If the face, including the teeth arrangement, has no abnormality, but if the face appears too wide, or the mental region is inconspicuous, or if there's an asymmetry of the mental region, or if it is simply too long, in such cases, facial contouring alone can bring enough improvement.
So how long is the recovery for double jaw surgery, and how long do we need to stay in Korea for this surgery?
I would say about 1 month, give or take. Normally, we schedule a checkup visit 1 week after the surgery and remove the stitches in the month 2 weeks after the surgery. But it is safe for us to check up to a month to see if the results stays stable. So, I would recommend 1 month. If you have an urgent reason to leave, a 2-week period is also possible, but I usually recommend 1 month.
So is there any other methods to correct facial asymmetry besides double jaw surgery?
It depends on each patient. If the center of the face has no asymmetry, but the contours do, facial contouring alone can provide sufficient improvement, and then there's the case. When the face is a bit off-center, but the patient is not bothered by it, then facial contouring can be enough. Fundamentally, facial asymmetry consists of not only the face being off-center, but also the contour is distorted along. So it is common for double jaw surgery to be more adequate and the more effective solution. But of course, there are individual differences for each patient.
So for patients who have short chins and protruded mouth, can it be improved by chinoplasty?
A protruded mouth and short chin often accompany each other. So people with protruding mouths often have short chins. What we aim for is to depress the mouth and protrude the chin. To make this happen, we consider ways to depress the mouth, which could be double jaw surgery, interior segmental setback, osteotomy, teeth extraction, etc. These various methods have to be taken into consideration. Chin protrusion can be done mainly through corrective jaw surgery, and often mouth depression can be achieved through braces, which means corrective jaw surgery alone can more often than not be effective. This makes corrective jaw surgery one of the more effective surgeries.
Today we learned many things about this transformative procedure, and the doctor explained in details everything related to double jaw surgery. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.